Okay, thank you for agreeing to this interview, and can you please introduce yourself first?
Okay, my name is Hurik Rakutumalala, and I am a pediatric surgeon. We are from the Lutheran Church in Madagascar. My congregation is at Antan Malandi, and I am the medical in charge of Antan Malandi Hospital, and she is my wife, Mireille.
Yeah, I'm Mireille Kutmalala. I'm the doctor in charge of the Shalom Health Program. I started my work 2 months ago, so I'm very happy to be here. Yeah.
So this interview is about malaria. Can you tell me about malaria in Madagascar and why it is so harmful?
Yes, malaria is a disease transmitted by mosquitoes, and the mosquito injects the parasite inside your body, and then it develops into your liver and then in your bloodstream. And when it comes at the time, then it's a lot of parasites in you. You have symptoms that are really not funny, because you have headache, you have photophobia, which means your eyes cannot support lights, and you have chills and fever at the same time. And it does occur at the beginning every over day or every 2 days. And if you do not treat yourself, especially when it's a type that is called falciparum, because it does have many types, then that's very harmful. Babies and young children die because of it, and it can be prevented. Like for pregnant women, they have to take prophylaxis tablets during their first, second, and sometimes in the third trimester of pregnancy. The use of mosquito net is very helpful now here in Madagascar. It's an impregnated mosquito net, and they use insecticides on the net, and when the mosquitoes come there, they die. It does have, in Madagascar, I think it's the second to third diagnosis that you made in people, and now there is a big change, because the numbers of cases has decreased a lot because of the use of mosquito net and the prevention. Yeah.
And Nure, do you, in your work with Shalom and their different clinics, do you see a lot of people coming to the clinics in the rural areas with malaria?
Yeah, for the last site visits that I made, we've met some cases, but most of the patients who came to us are pregnant. So the main thing that we have done are prophylaxis for pregnant women. And of course, those places where we have the health centers in the bush, they are very bushy, and they have those stagnant water around that are really the place for the mosquitoes to grow.
Okay.
So they are really at risk of malaria, but the time I went there, I didn't find much, but I found some cases.
So the mosquitoes grow in the stagnant water. And
yes.
what is the medicine that the pregnant women take?
They are taking for prophylaxis Fansidar. It's a pyrimethamine sulfadoxine medicine, 3 tablets the first trimester, then a second cure also at the second trimester. Yeah.
Can I ask you what more you think needs to be done in Madagascar to help eradicate malaria?
I think that the use of mosquito net is really needed, and also teaching about hygiene, cleaning up around the compounds, because mosquitoes cannot fly more than 50 meters, 25 to 50 meters. And if it's clean around the compounds, that's going to help. The use of mosquito net is a bit funny, because people, when we were funded and the government gave free, people are using them to catch fish,
Ah.
and then they do not have a protection, and then they still get it. So poverty is there, but I think providing again the mosquito nets and teaching education. Of course, the use of malaria prophylaxis is also very important, and it has to be spread all around the country. For us in the hospital, and for Shalom too, I think mobile clinic to go to the bush is very important, and that needs a big support for to build a mobile clinic for teaching health all around in Madagascar. I think I would suggest for a mobile clinic. Yeah.
In your 6 months here and 2 months here respectively, have you become familiar with any work that the Lutheran Church in Madagascar, the FLM or the Mahajanga Synod is doing to help prevent malaria?
Yeah, for that last 2 months, I've seen those prophylaxis for pregnant ladies, promoting the use of nets for the people.
And
That's
and also the government has funded also a free testing for malaria, which is called TDR or TRD, rapid diagnostic test, and it's a very good one because if it is negative, then it's very sensitive for negativity, and if it is positive, then you treat it. It's a very fast treatment, and the government has done, but we are a private sector. Then we need to, even the government has provided some, it's not enough, but it's a very helpful to be promoted also. And Shalom, I think, does not have it yet.
Yeah, but we are working with some
NGOs.
NGOs in the country.
Which is
UNICEF,
non-governmental organization.
Yes,
Okay.
NGO. Then the UNICEF will provide that testing for us.
For Shalom.
For Shalom.
Oh, good.
I ordered it through Salfa in Antananarivo. So it's just I have just to go and pick it. It's a big bunch of tests that they will give us to
Okay.
take to the sites.
Yeah.
Very, very good. Okay. Well, thank you very much for
You're
this
very welcome.
interview.
Yes.